All right, so I thought I'd hop back on because I did get my blood work uh, back and kind of give you what's happening while I'm taking Retatrutide, 1 milligram every 7 days. I'm taking SLU, taking 500 micrograms every day before I work out, and taking 10 milligrams of uh, methylene blue, same thing in the morning. And I went from 2 IUs of GH up to 3 IUs of GH. The testosterone hits 250 every other day, and Masteron at 50 milligrams every other day with that. No AIs, no Proviron, nothing else for that. Um, that's it as far as like peptide use and such. So I'm not taking any BPC or TB500, just solely relying upon the growth hormone. And I'll go ahead and share my screen. Let's see. I think this will work. Okay, so all right. And again, HDL, this is good since mine is typically like in the 20s. So this is taking it higher. And this is also, again, I had surgery April the 1st. It's taken me like 2 months to fully recover from having a hematoma and going through that process. And I wasn't able to take fish oil. So this is without taking fish oil for within like over 2 months. I just started fish oil after this blood work. And um, yeah, I think that's the only difference. So the previous blood work I had, I was on fish oil, which it didn't do much. We'll look at a comparison to see kind of like what was trending. And you could see total cholesterol, triglycerides, they're all pretty low. That's how it always is. My HDL to LDL ratio, again, if you have a very low HDL and a very high LDL, then I would be more concerned. But because my LDL is low, my HDL doesn't need to be super high. So again, I try to think of it as the LDL as your Ubers and HDL as the people waiting for the Ubers. So again, we don't want too many Ubers backed up, causing traffic jam or not getting paid, nor do we want tons of people crowded around waiting for Ubers to get us around. So that would not work well within our cardiovascular system. Glucose is 70, so this is also post-workout. So I did work out and I went and had this blood work done. Um, I think it was like an hour after my workout, 2 hours, yeah, probably like an hour after my workout. And didn't have any carbohydrates. I had a protein shake and and a little bit of electrolytes, but I was still dehydrated. So you'll see the bun creatinine ratio a little bit high, slightly high. Again, that's just because I post workout. Same thing with you'll see over here when it's isolated the bun. So dehydrated, just hard to get enough fluid back in me. And again, this workout wasn't intense, so this was not a leg day. If uh, that were the case, then ALT and AST would most likely be high as more of a higher volume day. Just I'm pretty sure it was my arms or shoulders. I can't remember. I didn't really want to work I think it was arms and abs. So before blood work, I don't want to do a large body part for exercise just because, again, we're going to skew some numbers and this isn't high ALT. If I remember correctly, it's more of a volume. AST, it's more of intensity, or it could be vice versa. I can't remember, but it doesn't really matter too much. So let's see. Okay, after that, again, lymphocytes on the lower side, just off of the coming out of the gym. That'll do it to you. Um, Nothing wrong with my blood count. Again, the higher testosterone that I'm taking, it's not causing any type of like increasing your size of your red blood cells, like the MCV. I don't have any hemoglobin problems. I don't have any hematocrit problems. We're on the high end, but that's totally fine. If you start having high ends of like hematocrit, red blood cell counts, hemoglobin, and these people like coaches tell you, oh, you need to go and do some blood dumping, right? Or donate blood. And that's not going to help you, man, because your body thinks after doing that, it's just lost a lot of blood. So it needs to make more. So you're not going to get rid of high hematocrit, high hemoglobin, high red blood count by blood dumping. Okay. It's just it won't happen. But as far as my numbers go for neutrophils, monocytes, basophils. Again, basophils, we really want like a 0. So like, you have some like gut permeability. You have a little bit of downregulation um, of the immune system coming off of working out. Your body's, you know, not really. It's not. It's not trying to fight off some sort of virus or bacteria that you see on here. I'm really just more fatigued than anything, and uh, training volume, and the fact that I didn't like eat anything could skew that a little bit. But we would like to see like, and again, gut permeability post workout, so that can cause a little bit of raise. Um, Again, 2.1, so we want that like 0. Um, let's see, LH, again, I don't produce any luteinizing hormone or follicle stimulating hormone, nor do I really care. I already have 2 kids, but I'm pretty sure that this number was pretty low whenever I had kids. So I don't really, I don't know. I think it's genetics if you are able to have kids or not while on anabolics. Or, I mean, maybe you have some sort of uh, like a like a DVT in your scrotum or something, right? That can cause an LH or FSH to be low as well. Um, I forgot what it's called. Let's see. Sex binding globulin. That's on the low end, very low end. And again, that's just genetic for me. Total testosterone is lower. For this one, so I've been doing my shots every other day. This one I took 2 days off of my injection. So the previous one was like 3,000 something. This one, and again, it depends on the test. Whenever they like, sometimes the test that they do can kind of skew the data whenever they're running these tests. And so I've seen some to where they're like 5,000 and such on other clients, and you ask them to go get it again, and it's back down to maybe like 800 or something. Or I'm not sure what goes on from from the blood draw to getting it tested, but sometimes things get a little hairy. So GGT liver is good. That's really what I look at for liver, not ALT and AST. IGF, again, I didn't want to take growth hormone the night before, so this is uh, like 2 days. So yeah, it's 2 days off of growth hormone. So I'm still I'm like above average. Um, Estradiol 10, so this is ultra sensitive. Again, I don't really aromatize. I have no problem with high estrogen, and I don't like taking Arimidex if I don't have to. And the Masteron can help, but usually Masteron, you still see high estrogen if you are a high converter, but you don't have like any estrogen side effects. So if this number were someone taking like test and primo, I'd be okay. Um, it's helping you control estrogen. And that's primo is what I would recommend if, again, we're on an anabolic cycle. if you have trouble with the aromatization and you don't want to take like a oral, like a Arimidex, then or a Remistane, like I would say we can go with Primo and can manage your estrogen that way. Some people, they don't want to take it. I don't force people to take anything. So, um, yeah, so everything else was within range. So I think we can look at like um, yeah, so here goes some data. So it's kind of like what's going on uh, with my blood work. And there's a point of time to where I didn't use lab Quest. I was using LabCorp just because I'm pretty sure it was cheaper to use LabCorp with private MD labs. And I'm not sure what went on there, but we're back at Quest. Or I was using St. Joseph's Hospital uh, down in Florida to get my blood work from my urologist. So we can see the trend of what's going on. And again, these two down here are really what I'm looking at because this is where my Retatrutide and SLU, methylene blue, uh, GH and such. This is kind of like what I've been tracking. And I have not gone up on Retatrutide, which is awesome. So you can get like 10 weeks worth out of one vial, which makes it very, very affordable. Like we see 137 from March of this year down to 117 in May. So we see a downward progression. HDL, see how low it used to be? So it used to be like in the 20s. This one was 33 for some reason. I don't know what went on during that time. But even this went up. So again, without taking fish oil and still continuing my Retatrutide, and I'm on a low fat diet. Um, that's really good. And triglycerides, again, really, really low, right? There was a point in time where I was also, maybe this was, I wish I would remember what was going on during this time as far as diet wise. I've done many types of diets. I've done a high carbohydrate diet, low protein, moderate fat. I've done high fat, uh, like a keto diet with higher protein, like modified keto. I've done regular keto for clinical keto, if you want to call it. And I've done carnivore. I've done pescatarian. I've done a lot of different diets, and I've done them for more than 3 months at a time, so I can kind of get a base of what's going on with the diets. Yeah, I'm not sure what was going on during this time. I bet it was this was the high carb, moderate fat, low protein. Um, but again, even here, LDL went down, so nothing changed with my diet, and I went up to 3. I used GH at the beginning of May, so this is May 21st was the blood work. So that really, that's the only difference. So again, dropping down, and I think this is Retatrutide, and my diet is still high carb, 1 gram of protein per pound of body weight, and low fat, 0.2 grams of fat per pound of body weight. Carbs, I hover around 3 to 4 grams of carbs per pound of body weight. So I'm like 215. So anywhere between 600, so like 800, sometimes 1,000. That's where my carbs are at, and they're not like sugar carbs. So this is not the sugar diet. All right. So we see that. Let's see. Is there anything else we can do? Um, we got this one. Let's see. So glucose. You see the ranges. The last time in April I ate food post workout, so that's why it's a little bit higher. This time I did not, except for the protein shake. So protein shake, this probably would have been lower if I didn't eat anything, but protein and fat, it'll mess with your glucose. just a tiny, tiny bit. Protein a little bit more, especially if I'm low on carbohydrates, um, then it will spike my glucose a little bit more, or whatever they put the ingredient wise inside the protein powders could do that as well. But it's like a it's like a false positive sometimes. So because even like the CGMs aren't accurate. So people think that they're really accurate. They're not, but you're consistently getting the same numbers. Uh, so like if you're consistent with inconsistency, so if it's not accurate, but you're consistent with the non-accurate, uh, then with the non-accurate readings, then you have some sort of data to go by. And at least if you're consistent with the inaccuracy, then you are consistent. So you get a good idea of what their numbers are. Um, so again, it's kind of going through this a little bit slower. Potassium's up a little bit, probably because the hydration stuff that I was drinking. Yeah, so the last blood test, I didn't take any hydration. This time I had a little bit of hydration along with my protein shake. So you see some of that. So protein higher, albumin, globulin. Okay. Um, yeah, wow. So you see some of my AST and ALT. So see what, yeah. So you see what I talked about before. Sometimes like I get pretty high on these, and I've had rhabdo twice. So I've um, rhabdo's not really your liver, but whenever I went into uh, the hospital for rhabdo, they check my kidneys and such, but they also check your liver. And of course, they're like, oh, you have non-alcoholic fatty liver disease, or you have metabolic syndrome, whichever one that they want to say. But they will find that number as well. And then you'll be like, no, it's training, I swear, because these ALT and AST numbers, they can be that high. If I got in a car accident and I came here and you guys took my blood, it'd be just as high. So you're stressing your body out while you're working out. And that's just what happens. So again, you see the slight increase from, we're looking at my hemoglobin, red blood cells, cardiovascular numbers. They went up a bit, and that's because my testosterone went up a bit. And still, the size of the protein really didn't change. Or the size of the protein, yeah, the size of the red blood cell didn't really change. Um, I'm sorry, guys, this is just me randomly doing this. I don't have like things written up to 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 talk about and rehearse before these videos. So it's probably boring. Thank you for staying. If you're even watching anymore or listening, I prefer listen. That's why I don't really have any graphics. But this one you might want to watch because there might be some graphics. Um, uh, okay, overtime. LH, see, always low. See, even in 2023, always low. My kids were born in 2017 and 2019. If I had that blood work, then I would show you. I just don't have that blood work. I've had everything on flash drives, pictures and such from back in the day, but I don't know where any of that stuff is at. We've moved a lot, so things get lost. This is back in, why is it my last? Oh, okay. I don't know why. Oh no, that is March. Okay. So 23 down to 9. Again, I don't aromatize, so if my test goes up, some crazy things happen. You know what I mean? Um, it's been like this for a very, very long time. My first coach even saw this stuff, Matt Porter, back in the day, and he was perplexed as well. So testosterone the last time, yeah, 3,000. So these would be like where I would do back in 2023. Uh, this was like I would do a shot every like 4 days. and I didn't take a lot of stuff, right? Went through, I had like, I had, well, had mouth cancer like 5 years ago, about now, but I was always scared to go back up in my dosage, my use of testosterone. I don't know why. I was just, you know, convinced that I would have issues of being like genetically predisposed to having that problem. So like it would exacerbate and quicken it. Um, but you see here, free testosterone is always high. GGT, same, roughly. Let's see if I even have. So again, growth hormone was taken. There's 1 day in between. So this was 2 days in between. And this was on 2 IUs. This is on 3 IUs, 2 days, uh, not taking any growth hormone. 2 IUs, 1 day not taking growth hormone. I'm not on growth hormone because I felt like if I were, it would exacerbate cancer. Okay, estrogen. This is not a maybe. Oh, why did it do that? Sorry, guys. I don't know what happened. Well, we got to go back and see what's going on. Yeah, my estrogen. There was a time again where I had high estrogen. But again, I was off on a lot of stuff. I was on medications. So you see it's always low. So I really don't remember what I was prescribed here. So I have maybe, so like I used to have pellets of estrogen. So this might have been like, maybe I just got a pellet put in. I don't know because I needed estrogen and there's a period of time, like right now in Texas, I don't have anybody that I trust around here. So pretty sure this is probably whenever I like got a pellet, not like soon after. So sometimes it can skew the data. Yes, pellet of estrogen. I know, but there's you don't need it. I could take Dianabol, but like I literally don't. Um, I don't have estrogen. uh, it's probably due to like my childhood, which I could talk about that if you guys wanted to, but medically, as a child, I went through a lot of different prescription drugs back in the 1980s, like 88, so whenever I was born. So from the 88 up to the early 90s, they put me on tons of medication as a child, and they were adult male doses. Ended up getting Cushing's and such, all because of atopic dermatitis, so like eczema and such. But it was super severe, and yeah. So the other thing I wanted to go over was the the cost of Marek Health. Okay. Now my wife, I I suggested her to use it because I assumed that they were good at what they do because of all the praise they get from other people. But I soon realized after the consults and the blood panel, how much it cost, and the communication between them and her, the treatment plan, it didn't make sense. Like so, like they were talking about uh, the increasing her. So they were talking about uh, oh, what is it? When you have too much carnitine. I don't know why I have C1T on my brain right now, but oh geez, hold on. Let me look at this. They were looking at blood work and I can't remember what it was, but it flagged high, and it's because carnitine um, increased consumption of carnitine. I know this is dumb. I cannot remember it. Carnitine. No, L-carnitine. Oh, I spelled it wrong. Oh, what is it? Um, man, sorry guys. Oh, TMAO, right? TMAO. That's what I don't know why my brain farted on that one. Too many acronyms. Anyways, they were blaming it on the white monsters ester drinks. And the white monsters barely have any L-carnitine, especially if you reverse engineer and find out how much L-carnitine is in there. And again, just because of that stupid comment, I'm like, these are women that are meant to help other women with blood panels, hormones, and such. Um, so I was just very put off by them. I definitely, whenever we need to go with someone else, it's Dr. Todley or Chris Tuttle. Those are the people I'm going with. I'm sorry, but Merrick Health is a disaster. I think they are not worth the money. So if you want to look, this is what so like there because we were talking about GLP-1s and they offer two of them because they don't offer retatrutide. But look at the price. So the cost is $1,250 for 10 milligrams. Okay. And semaglutide, you got a dose higher than retatrutide, and it just helps with reduction of hunger. Well, that's not what we really wanted. We wanted the third generation because we wanted to help with blood lipid management because her cholesterol, which whenever she gets her blood work back, I will go through hers as well. Tirzepatide, the second generation, so it helps has the GLP-1 and the GIP, not the glucagon. So, but that costs $1,400 for 40 milligrams. And again, the dose is higher. So right now we have my wife on 1 milligram of retatrutide every 7 days, same as me. But then I think she started having like hypoglycemic problems, and so we backed it down to half a milligram every 7 days, and things are clearing up. But look at the prices of some of these things, right? So um, they want to put her on like statins, like ezetimibe, 135 for 90 days. And again, the thing is, why would I want to put her on a statin, which I'm not a big fan of statins because it can cause muscle fatigue. And I don't care what people say, ezetimibe is not the best form, like as far as like risk free. These people still have it. You can't just boldly say, well, this one won't cause muscle soreness or muscle weakness. Like that's what statins do, right? I do not care what other bodybuilders say. They are pushing through whatever they are not feeling. She's not on any anabolics. These bodybuilders that are on ezetimibe just presumptively because they're on anabolics, they think they need to take these drugs, which is a dumb idea. Wait until blood work and symptoms show you if you're symptomatic. Yeah, get on it, but don't just take it just because you started something. Fish oil, $135 for 90 days protocol. Same fish oil that you can get elsewhere, $80 for magnesium glycinate. Who the $180 for glutathione injections? Okay, but I can get way better deal of glutathione injections on uh, Amino Asylum or other companies, right? It's just my retatrutide's way cheaper than that. They're not worth the price. I definitely recommend not going to Marek Health. If you're a competitor, an elite competitor, athlete, sure, go to them because they're going to give you the time of day. If you're just a regular person, do not go to them. There's way better people out there, way better people. I'd rather go to other clinics. Shoot, I'd rather go to Titan Medical than them. It's not worth your time. I don't know who's paying for all that. Obviously, people who are oblivious and don't understand the industry, which I think Merrick Health is taking advantage of those people, which I really hate when companies and people do that. I think it's very bad ethics and morals on their part. So I'm just not a fan of them. I would never go to Merrick. And these people that are sponsored by Merrick, of course, they're going to tell you to go because they get a kickback. Um, and they get treated way better. So I just, it's a waste of time. Um, anyways, so that's my update on blood work, and it's kind of boring, but this is what it is. And I haven't changed anything in my diet. And again, I told you what I changed. It's just the growth hormone went up 1 IU. And the growth hormone that I use is an underground growth hormone, and uh, I'm not a fan of like Cerestem, and I don't, and I've used pharmaceutical in the past, and I'm very sensitive to growth hormone. So like one IU of Cerestem pharmaceutical, I was getting severe water retention, but yeah, I'm not a fan. I'd rather use like genotropin, uh, but yeah, that's the only thing different. If you have any questions, comments, like, share, subscribe, things like that, please do.